Meanwhile, Ontario's COVID Science Advisory Table has released what it calls the way forward, with a list of 6 things that will reduce COVID-19 transmissions. For more on these new recommendations, let's bring in Dr. Peter Jüni. He's the Table's scientific director. He's a professor at the University of Toronto. Dr. Jüni, thank you for joining us here on The Weekend. Appreciate your time.
Good morning. Thanks for having me.
Let's talk about what prompted these new recommendations.
Well, we just wanted to make sure that everybody is very clear about what is needed now. This is basically just a list of recommendations that makes a complete sense if you understand the epidemiology of this disease. It's a disease of essential workers and their families. It's a disease that is predominantly transmitted inside. If we actually just, refer to these 2 different characteristics and then use common sense and a bit of scientific data, we're able to do the right thing.
Okay, so inside essential workers, that's pretty specific. How would you like to see those groups targeted?
So if you think about what's going on, where we were very weak, during the last months actually, is with a distinction between what is really essential work and what is not. Remember, it's challenging. If you're inside, this means that you always have a residual risk for transmission or infection. And therefore, you would like to have as few people as possible inside. So there should only be in a workplace if it's absolutely necessary for society to go on. Then, there's, of course, workplace safety. That's the other aspect. Then here we are coming again, with what is tremendously important. Only if you have a paid sick leave that actually works. A worker needs to be able, if they are ill today with a sore throat, needs to be able to call their employer and say, I have a sore throat, I'm not coming, and that's it. Everything else needs to be looked after. That's when paid sick leave works in other jurisdictions. That's what we need to achieve.
We saw the Premier come out and say that this is something that they are working on to bridge that gap between a worker phoning in sick in Ontario. Okay, you're wagging the finger. Okay, you see, take it from
that's
there.
A misunderstanding.
Okay.
What he said is, which is a complete misunderstanding of the situation, he wants to bridge the gap for the few days that are not being paid. Right. That's not the problem. We've seen the Premier struggling with a laptop. Okay, so when you think about that, how is it for an essential worker who actually needs to apply for paid sick leave? The burden needs to be on the employers, and the employers need to know basically that if they continue to pay their salaries of the workers, that they will be able to get a refund. That's all. That's as simple as that. So the burden cannot be absolutely not on the essential workers. This doesn't work, and we've seen this in other jurisdictions go wrong. And if you want to have a proof of concept that it doesn't work, look at the federal paid sick leave program. It never worked properly.
So what do you want the province to do?
Well, first of all, I'm not in a position to, I can tell you what is needed, but This is not about whether I want it or not. But if we want to get this now under control, and remember, we only achieved a flattening of the curve, our ICU admissions continue to go up. If we want to get this under control, we need a really short list of essential workplaces that needs to stay open. Everything else needs to close. Then we need to make sure that people are being paid in a practical way for staying home if they're sick or have been exposed or need to get vaccinated or whatever the reason is. That's the way to get this part, under control. And then, of course, we can help with properly vaccinating those places, those neighborhoods, etc., that need it most.
Is part of the issue around what has been a broad definition of essential worker? What, in your mind, is an essential worker?
Well, I think it's important just to really clearly distinguish between what needs to go on, essential goods that need to be distributed, of course, but only the essential ones, and what not necessarily has to be. I can't see, that some luxury goods still need to be manufactured. I can't see that the condo building in downtown Toronto needs to continue. We just need to be very clear there now. This is not the time of compromises.
So constructing of, say, health facilities or a school, I guess I'm just trying to get a greater sense, because there seems to be a lot of wiggle room in the definition, and regardless of what measures are taken, that presumably can expand the risk group exponentially in terms of having too broad a definition of who is allowed to work.
This is correct. We're just talking about a few weeks now. So we need to be very careful what really remains essential. If we talk about, constructions, probably the world will not come to an end if even a school construction, just takes a little bit longer. For example, there are very few, construction situations where you probably just need to continue. And I can see it's also sometimes, in people's homes where there's something really essential. I can see that there are some exceptions, but, there is not much wiggle room there, and we just need to make sure that we are now really stringent. This is, the way to enforce things. This is proper enforcement if we make these clear distinctions, and if we really have inspection blitzes by work inspectors, health and safety inspectors, and make sure that everything is according to the book. It's simple rules. If you're inside with other people, keep it as short as possible, and you absolutely must wear a mask all the time. You can't imagine what I see go wrong, even if I just walk and go and get some food sometimes, or if I look at the playground, where kids are too close to each other and don't wear masks, we can do much better.
We've seen, for example, the closure at the Amazon plant. We've seen the outbreak there as it has gone on, but so many stores are closed. That's what I'm saying. When you define essential, is Amazon essential in the world we live in now, or can more be done there?
I'm probably the wrong person to ask. I'm a scientist, but I see that Amazon has a really important role to play right now with the distribution of goods. But what we need to be aware of is I have my serious concerns that Amazon does everything they can actually to keep their workers as safe as they can, and we just need to be aware of that. We need to get better there too, and it's the absolutely right decision of Lawrence Law and Eileen de Villa now to really say, okay, if we have an outbreak situation in a facility, we close these facilities. That's what is needed right now. We're too desperate.
Yeah, and just for our viewers, you're referencing the Medical Officer of Health for Peel Region and for Toronto, where they have invoked this Section 22, where there have been 5 outbreaks, 5 cases over the course of a week or so. They're shutting down that workplace, just so people understand that. Okay, Dr. Uni, as you say, you are a scientist. So as a scientist, what is your biggest concern at this stage of the pandemic?
Well, the biggest concern remains that our ICU occupancy goes up and up and up again. And remember, everybody, I hope, is aware of that now. We're talking about young people who are on these ICUs. And it's a real challenge that we're facing there. We're really at the limits there. This means, even though we probably managed now as a first step, which is excellent, that's because of all of us, doing the right thing, that the curve is flattening at a high plateau. We now need to get these numbers down as soon as possible. In addition, we need to use our vaccines as wisely as we can. And by that you mean target hotspot areas and target hotspot at-risk groups. Exactly, including, again, essential workers and their families. We have a challenge right now that we just need to address. If we want to do that well, we now need to benefit also from the indirect effects of vaccines. That's new data that came out just a few weeks ago that really indicate now we not only directly protect a person, by the vaccine from getting severely ill, but we also protect indirectly other people who are not yet vaccinated, because this person who gets vaccinated is less likely to transmit the disease. And we need to leverage both of those. So if we go into hotspots that are actually severely affected and try to vaccinate everybody we can above the age of 16 or 18, this will then be hopefully 70 or 80%. This means that we achieve something like herd immunity in this area. And what this also means is that everybody there is protected, both people at the highest risk. And it also means that these areas don't spill over to other areas. So everybody benefits. But this means we need to let go of the idea that we can do all of that just, on a per capita basis, that the population size determines the number of vaccine doses. That's not what needs to happen now if we want to use vaccines wisely and want to make sure that the entire province benefits. The province benefits when we get all the hotspots under control. And that's certainly been something that Dr. Peter Lynn has been advocating on our program for weeks now. Dr. Uni, I want to thank you for your time. Please enjoy the rest of your weekend. Thanks for having me.
Dr. Peter Ewing is the Scientific Director of the Ontario COVID-19 Science Advisory Table and a Professor of Medicine and Epidemiology at the University of Toronto.